Hi, I'm Amanda from Palmer Health, and it's the start of summer here in the Mediterranean, so I want to talk about drowning and secondary drowning. If you see a child or someone struggling in the water, obviously get them out of the water. Make sure you're safe before you go in there. And the main thing is first of all, check that they're breathing. So here's my baby that I prepared earlier. And the first thing I'm going to do is check the rise and fall of their chest. You can put your hands on their chest, always ask for permission first, and see if you can feel them breathing. I like to breathe with the person. So if I find myself breathing with the person and breathing too fast, and I have to stop and take a breath, I know it's not maintainable for the person. If I've got to breathe really slowly with them, and stop and grab a breath, I also know it's not maintainable for the person, so I'm going to call for medical assistance. If the person's breathing, the next thing we want to do is check their pulse. We feel their pulse, first of all, the radial pulse, which means the pulse in the wrist, and I put 3 fingers down flat under the thumb and see if I can feel a little beat, beat, beat. It's a really good idea you try and feel your kids' pulses so you know where they're there. The more you try it, the better you'll be at finding it in an emergency. If you're sure they don't have a pulse in either wrist, it's a sign that they're going into shock and their blood pressure's very low. So what you want to do is raise their legs. But because they've had a near drowning and they're having trouble breathing, you'd also want to sit them up in a V. The main thing to think about breathing issues is that we need to be sitting upright. If we try and breathe like this, it's really hard. So position them so they're sitting up, and we're giving them as much chance to breathe as we can. Then we're going to keep an eye out for strange behaviour. Hyperactivity and frustration are absolute keys that the child is suffering a secondary drowning. If you see any abnormal behaviour or extra hyperactivity, please call the ambulance and present to the hospital immediately. If you're not sure, I suggest you wake them up every hour and encourage deep breathing and coughing, or if they scream at you for waking them up, then that's a good result too. If you've got any other questions, always call your 24/7 medical support, your NHS Direct, you should all know if you don't have your numbers for your emergency services, you're a bloody idiot. Get them on the fridge immediately. But the main thing is Dr. ABC. Danger, make sure that you're safe, you're not going to endanger yourself rescuing the person. Response, get a response out of the person. It's easier to look after a conscious person than a non-unconscious person. Airway, make sure they've got an airway with a head tilt and chin lift. And if they aren't breathing, we go straight into CPR. Nothing else. Not breathing, CPR. We'll do that another day. If they are breathing, check their pulse and position them accordingly in the V position. Then we can start assessing them and seeing if they're acting abnormally or if we think they need medical support. Wake them up every hour, encourage deep breathing and coughing to really try and get all that water out of the person's lungs. If there's anything else you need to ask, or if you have any questions, send us a message, and I hope this has been useful. Stay safe around the pool. And just remember that 1,000 people die in each state in Australia each year because they didn't learn CPR and first aid. So keep your skills up. Just because you did it in high school doesn't mean you'll remember it now. Even as a nurse, I have to revisit these skills all the time. The only reason I can do first aid is that I teach it every day. So keep watching, stay tuned, and there'll be lots more coming in the future. All right, stay cool. Thanks, everyone.